How Newcastle disease spreads. The virus spreads rapidly through direct contact with infected birds, contaminated feed and water, droppings from infected birds, contaminated equipment, clothing, footwear, and vehicles, wild birds and other animals carrying the virus, airborne transmission over short distances. Because the disease spreads very quickly, one infected flock can infect an entire poultry farm within a short period. How to recognize Newcastle disease. Symptoms vary depending on the strain of the virus and the age of the birds. Respiratory signs: gasping for air, coughing and sneezing, nasal discharge, difficulty breathing, rattling sounds when breathing. Digestive signs: greenish or watery diarrhea, loss of appetite, weight loss, poor feed conversion. Nervous signs: twisting of the neck, torticollis, paralysis of wings or legs, trembling, circling movements, loss of balance. General signs: sudden increase in mortality, depression and weakness, drooping wings, reduced growth rates, birds gathering near heat sources. In severe outbreaks, mortality can exceed 80% if the flock is unvaccinated. Prevention of Newcastle disease. Prevention is far more effective than treatment. 1. Vaccination program. Vaccination is the most important method of prevention. A typical broiler vaccination schedule may include Day 1 to 7, Newcastle disease vaccine. Day 14 to 21, booster vaccination. Additional boosters according to veterinary recommendations and local disease risk. Always follow the vaccination program recommended by a poultry veterinarian. 2. Biosecurity measures. Strict biosecurity reduces the risk of introducing the virus onto the farm. Important measures include: restrict visitor access, use foot baths containing disinfectant, disinfect equipment regularly, wear dedicated farm clothing and boots, control rodents and wild birds, prevent contact between different poultry flocks. 3. Proper farm management, provide clean feed and water, maintain good ventilation, avoid overcrowding, reduce stress caused by heat, cold, or poor handling. Remove dead birds immediately and dispose of them safely. Treatment of Newcastle disease. There is no specific cure for Newcastle disease because it is caused by a virus. Treatment focuses on supportive care to reduce losses and prevent secondary infections. Supportive measures include providing vitamins, especially vitamins A, C, and E, administering electrolytes to prevent dehydration, ensuring birds have easy access to feed and water, using antibiotics under veterinary supervision to control secondary bacterial infections. Affected birds should be isolated where possible to reduce the spread of infection. What to do during an outbreak. If Newcastle disease is suspected: 1. Isolate the affected flock immediately. 2. Restrict movement of people, birds, and equipment. 3. Contact a veterinarian for diagnosis. 4. Increase biosecurity measures. 5. Dispose of dead birds safely through burial or incineration. 6. Thoroughly clean and disinfect poultry houses after the outbreak. Conclusion: Newcastle disease remains one of the greatest threats to commercial broiler production. Because there is no cure for the disease, prevention through vaccination, biosecurity, and good management practices is essential. Early recognition of symptoms and rapid action during an outbreak can significantly reduce losses and help protect the health and productivity of a broiler enterprise.